The luminescent surgical bay aboard the galactic medical vessel Helios dimmed as Dr. Zex Vormith stared in abject horror at the scan results floating in the holographic display. His forearms trembled, causing the medical instruments to clatter against the metal tray. The massive growth on the human patient's abdomen was unlike anything he had encountered in his 15 cycles as the ship's chief xenobiologist. "By the 7 moons of Krylax," Dr. Vormith whispered, his large oval eyes blinking rapidly in succession, a sign of extreme distress among the Xelorians. "I have never seen such an extensive formation in any species." The human patient, Yuri Galloway, lay on the examination table looking surprisingly calm despite the enormous bulge protruding from his lower abdomen. The medical scanner continued to whir softly as it mapped the internal structure of the growth. "Is everything okay, doctor?" Yuri asked, noticing the alien physician's distress. "You look like you're about to pass out." Dr. Vormith's blue-tinged skin paled to an ashen gray. "Mr. Galloway, I must be frank with you. This growth, it is massive. I have never seen anything of this size in a living organism that wasn't already terminal." Yuri propped himself up on his elbows, wincing slightly at the strain. "Oh, the tumor, relax, it's benign. My doctors back on Earth confirmed it before I left on this mining expedition." "Benign." Dr. Vormith repeated the word as if it were in a foreign language. "How can something of this magnitude be benign? It's the size of a Xelorian moon fruit." The doctor's assistant, Nala Tech, a slender Procyon with translucent skin and visible circulatory pathways, entered the bay carrying additional scanning equipment. She froze when she saw the holographic image. "Dr. Vormith, shall I prepare the emergency stasis chamber?" she asked, her voice barely audible. "No," Yuri interjected with surprising confidence. "Really, it's not cancerous. It's just a lipoma, a fatty tissue growth. They're common in humans. I've had it for years, but it's gotten larger recently, which is why I finally decided to have it removed, Doctor." Vormith's breathing began to stabilize as he processed this information. "You mean to tell me that humans regularly develop growths of this size and they're not life-threatening?" "Well, not regularly, but it happens," Yuri explained. "Mine is unusually large, which is why I waited until I could get to a medical facility with advanced surgical capabilities. The Earth doctors said it was too complex for a standard procedure." The doctor approached the holographic display again, this time with scientific curiosity replacing his fear. "Fascinating. In Xelorian physiology, any growth larger than a digit would be immediately concerning and likely fatal." Nala Tech moved closer to examine the scan. "The human tissue seems remarkably accommodating to such expansions." Dr. Vormith manipulated the holographic display, zooming in on different sections of the tumor. "I see no signs of malignancy in the tissue density or structure, but the vascularization is extensive." "This would be a complex extraction." "That's exactly what my doctors said," Yuri nodded. "They recommended I seek treatment at an advanced facility. When I got this mining contract in the Epsilon sector, I figured the Helios would be my best option, Doctor." Vormith straightened his posture, professional pride beginning to override his initial shock. "While I've studied human physiology extensively, I have limited practical experience with such procedures on your species. I would need to consult with our database and perhaps reach out to Earth's medical network." "I understand," Yuri said. "I've brought my full medical history and the surgical plans my Earth doctors developed. They're on my personal data chip." Nala Tech retrieved the chip from Yuri's belongings and inserted it into the medical console. New information flooded the holographic display, detailed scans, medical notes, and a proposed surgical approach. "This is quite thorough," Dr. Vormith noted, his 4 eyes rapidly scanning the information. "Your Earth physicians have mapped the vascular connections extensively. However, I noticed they've highlighted several high-risk areas where bleeding could be significant." "Yeah, that's why they suggested I wait for advanced care," Yuri explained. "The tumor has wrapped around some important blood vessels. They were concerned about blood loss during a conventional surgery." Dr. Vormith's professional demeanor returned fully as he immersed himself in the medical data. Our vessel's surgical capabilities include microvascular sealing technology that would mitigate that risk. We could potentially complete this procedure with minimal blood loss. That's great news, Yuri said with relief. How soon can we schedule it? This thing is getting pretty uncomfortable, especially in the mining suit. I will need approximately 24 Earth hours to prepare properly, Dr. Vormith replied. I must familiarize myself with the specifics of human adipose tissue removal and calibrate our equipment accordingly. That works for me, Yuri agreed. The mining crew isn't scheduled to begin operations for another 3 days. Dr. Vormith instructed Nala Tech to prepare a room for Yuri in the recovery ward. As she led the human away, the doctor remained in the surgical bay, studying the scans with intense concentration. Despite his initial terror, his scientific curiosity was now fully engaged. The next morning, Dr. Vormith called an emergency meeting with his medical team in the ship's conference room. The holographic projection of Yuri's tumor rotated slowly above the central table. I have spent the night reviewing all available data on human lipomas and consulting with medical databases from 3 systems, he announced to the 5 alien medical professionals gathered around him. While this growth is exceptionally large by any standard, I believe we can safely remove it using our vessel's advanced surgical systems. Dr. Lirith, a Centaurian neurologist with a cranial ridge that pulsed with bioluminescent patterns, leaned forward. What about the human's pain tolerance during recovery? Their nervous systems are notoriously sensitive. I've prepared a post-operative pain management protocol specifically calibrated for human physiology, replied Dr. Vormith. Mr. Galloway will experience minimal discomfort, Dr. Krell, the ship's anesthesiologist, a bulky draconian with scaled skin that shifted colors with his mood, raised a clawed hand. I've reviewed the human's metabolic rate. Their processing of sedatives differs significantly from most species we treat. I will need to maintain constant monitoring to prevent consciousness during the procedure. Understood, Dr. Vormith nodded. The procedure itself will take approximately 4 hours. I will require all of your assistance. As the medical team dispersed to prepare, Dr. Vormith retreated to his private office. Despite his confident presentation to the team, he still harbored concerns. He had treated humans before, but never for something so extensive. He activated his communication terminal. Connect me with Dr. Elena Vasquez at Earth Medical Central, he requested. After a brief delay, the image of a human female doctor appeared on the screen. Dr. Vormith, it's been a while. How can I assist you? Dr. Vasquez, I have a human patient with an exceptionally large lipoma. I'm scheduled to perform the removal tomorrow, and while I've studied the procedure extensively, I would value your insights. Dr. Vasquez reviewed the scans Dr. Vormith transmitted. That is indeed substantial, but your approach seems sound. The main concerns will be blood loss and ensuring complete removal to prevent regrowth. Your vessel's microvascular technology should give you an advantage over what we can do here. Their conversation continued for nearly an hour with Dr. Vasquez providing valuable insights into human tissue response and healing patterns. By the end, Dr. Vormith felt considerably more confident. The morning of the surgery arrived. Yuri was prepped and brought to the surgical bay, where the medical team waited in sterile gear. How are you feeling, Mr. Galloway? Dr. Vormith asked as the human was transferred to the operating table. Ready to get this thing off me, Yuri replied with a nervous smile. It's been a literal weight on me for too long. We will take excellent care of you, Dr. Vormith assured him. Dr. Krell will now administer the anesthetic. Please count backward from 10. 10, 9, 8. Yuri began but didn't make it past 7 before the carefully calibrated anesthetic took effect. Dr. Vormith activated the surgical field, a shimmering energy barrier that would prevent any potential contamination. The team moved into position, and the doctor took a deep breath. Beginning primary incision, he announced, his 4 hands working in perfect coordination as he manipulated the laser scalpel. The procedure progressed methodically. Dr. Vormith's initial fear had transformed into focused precision as he navigated the complex network of vessels feeding the massive growth. The tumor was even more extensive than the scans had indicated, with tendrils extending deeper into the surrounding tissue. Blood pressure dropping slightly, warned Dr. Krell after the second hour. Nothing concerning yet, but worth monitoring. Acknowledged, replied Dr. Vormith, not taking his eyes off his work. Nala increased the nutrient infusion by 10%. As the third hour approached, they reached a critical juncture where the tumor had wrapped around a major blood vessel. This connection is more complex than anticipated, Dr. Vormith noted. The tissue has created an unusual adhesion to the vessel wall. Dr. Lirith moved closer to observe. Perhaps the micro-separation tool would be more effective here. Dr. Vormith nodded and switched instruments. With painstaking precision, he separated the tumor from the vessel, using the ship's advanced technology to seal tiny bleeders instantly. By the fourth hour, the massive growth had been completely freed from its surrounding tissue. Dr. Vormith carefully lifted it from Yuri's abdomen and placed it in a specimen container. Final weight, 7.2 kilograms, announced Nala Tech after scanning the removed tumor. Approximately the size of a Xelorian infant. Remarkable that a human could sustain such a growth without systemic failure, commented Dr. Krell, his scales shifting to an impressed purple hue. Dr. Vormith began the closure process, using regenerative gel to promote healing and minimize scarring. The human body's ability to adapt to physical anomalies is quite extraordinary. In most species, something of this magnitude would have caused catastrophic organ failure. With the procedure complete, Yuri was transferred to the recovery ward. Dr. Vormith remained at his bedside, monitoring his vital signs as the anesthesia began to wear off. 3 hours later, Yuri's eyes fluttered open. He looked disoriented for a moment before focusing on Dr. Vormith. Is it gone?" he asked, his voice hoarse. "Completely removed, doctor." Vormith confirmed with satisfaction. "The procedure was successful. How are you feeling?" "Like a weight has been lifted," Yuri attempted a smile. "Literally." "The human sense of humor remains intact," Dr. Vormith noted with approval. "That's a positive sign of neurological function." Over the next 3 days, Yuri's recovery progressed remarkably well. The regenerative gel accelerated his healing far beyond what would have been possible with Earth medicine. Dr. Vormith visited frequently, monitoring the healing process and developing a new appreciation for human resilience. On the 4th day, Dr. Vormith entered Yuri's room with a data pad. "I have good news, Mr. Galloway. The pathology analysis confirms what your Earth doctors suspected. The tumor was completely benign, a complex lipoma with no signs of malignancy." Yuri sat up in bed, already moving with greater ease. "That's a relief, even though we expected it, and please call me Yuri." "Very well, Yuri," Dr. Vormith agreed. "I must admit, when I first saw your scans, I was concerned." "Terrified looked more like it," Yuri grinned. "Your skin turned almost white." Dr. Vormith's skin flushed slightly blue with embarrassment. "In Xelorian medicine, growths of that size are invariably fatal. Our tissue doesn't accommodate expansion the way human tissue can." "Different evolutionary paths, I guess," Yuri suggested. "Indeed, doctor." Vormith nodded. "Which brings me to a request. With your permission, I would like to include your case in our medical database. The information could be invaluable for other physicians who might treat humans in the future." "Of course," Yuri agreed readily. "If it helps others, I'm all for it, doctor." Vormith hesitated before continuing. "I would also like to keep a small tissue sample for research purposes. Human adaptive capability is quite remarkable." "Sure, why not? Just don't clone me or anything," Yuri joked. "Cloning is strictly regulated by the Galactic Medical Ethics Committee, doctor." Vormith responded seriously, missing the humor. "I assure you the sample would only be used for comparative tissue studies." Yuri was cleared to return to his mining duties a week after the surgery, with instructions to avoid heavy lifting for another 2 weeks. The regenerative treatment had closed his incision completely, leaving only a faint line where the massive tumor had once been. Before Yuri left the medical vessel, Dr. Vormith requested a final meeting in his office. "I wanted to thank you, Yuri. the doctor said as the human took a seat. "Thank me? You're the one who removed that thing. I should be thanking you." Dr. Vormith's 4 hands gestured in a Xelorian expression of respect. "Your case has taught me an important lesson about assumptions in xenomedicine. I allowed my own species' biological limitations to color my initial assessment of your condition. We all have our biases," Yuri shrugged. "I probably would have panicked if I saw something normal for your species." "Nevertheless, it was unprofessional," Dr. Vormith insisted. "A physician must approach each patient with an open mind, especially in multi-species medicine." "Well, I'm just glad everything worked out," Yuri said, standing and extending his hand. Dr. Vormith had studied human customs and knew to extend one of his upper right hands for the traditional shake. "If you experience any complications, please return immediately. Otherwise, I recommend a follow-up scan in 6 months." "Will do, doctor. Thanks again." After Yuri left, Dr. Vormith turned to his research terminal and began recording his observations for the medical database. The experience had sparked an interest in human adaptive physiology that he intended to pursue further. 2 months later, the Helios received an emergency call from the mining colony on Epsilon Roman 4. A transport shuttle was inbound with an injured miner who had been caught in a rock slide. Dr. Vormith and his team prepared the emergency bay, not yet knowing the identity of the patient. When the shuttle docked and the injured miner was brought in, Dr. Vormith was surprised to see Yuri Galloway on the stretcher, his leg bent at an unnatural angle and his face contorted in pain. "We meet again, Mr. Galloway," Dr. Vormith said as he began scanning the injured limb. "Though I would have preferred different circumstances. Just my luck," Yuri grimaced. "Finally get rid of the tumor, then break my leg." The scan revealed a complex fracture of the femur with bone fragments threatening nearby blood vessels. Dr. Vormith, now much more confident in treating human patients, quickly developed a treatment plan. "The fracture is severe but repairable," he explained to Yuri. "We'll need to surgically realign the bone fragments and secure them with a biodegradable lattice that will support healing." "Whatever you need to do, Doc," Yuri replied through gritted teeth. "I trust you." The surgery to repair Yuri's leg was significantly less stressful for Dr. Vormith than the tumor removal had been. He worked efficiently, applying his expanded knowledge of human physiology to ensure optimal healing conditions. After the procedure, as Yuri recovered in the same room he had occupied months earlier, Dr. Vormith reflected on how much his perspective had changed. The sight of human blood no longer caused him anxiety, and he found himself fascinated rather than frightened by the differences between species. "The bone is already showing signs of cellular activity at the fracture site," Dr. Vormith informed Yuri during a checkup 3 days after surgery. "Human regenerative capacity continues to impress me. Glad to be a good specimen," Yuri joked weakly. "How long until I can get back to work?" 8 weeks minimum, Dr. Vormith stated firmly. "The lattice needs time to integrate with your bone tissue, and you'll require physical therapy to regain full strength." Yuri sighed. "The mining company won't be happy about that." "I have already communicated with your employer," Dr. Vormith assured him. Galactic labor regulations are quite clear regarding recovery periods for severe injuries. Over the following weeks, Dr. Vormith supervised Yuri's recovery closely. The human's bone healing progressed well, but Dr. Vormith noticed something concerning during a routine scan 5 weeks after the surgery. "Yuri, there appears to be a small mass forming near your previous surgical site," Dr. Vormith said, showing him the scan. "It's very small, but given your history, I believe we should investigate." A shadow of worry crossed Yuri's face. "Could the tumor be coming back? It's possible we didn't remove all the cells during the original surgery," Dr. Vormith admitted. "Let's not jump to conclusions. I'll perform a needle biopsy to determine what we're dealing with." The biopsy was conducted that afternoon, with Dr. Vormith carefully extracting a tiny sample of tissue from the newly detected growth. The ship's automated pathology system analyzed the sample within hours. Dr. Vormith studied the results carefully before returning to Yuri's room. The human was sitting up in bed, reading from a data pad, but set it down immediately when the doctor entered. "What's the verdict?" Yuri asked, tension evident in his voice. "It is indeed a recurrence of the lipoma," Dr. Vormith confirmed. "However, it's very small and in an early stage of development. This is not uncommon with lipomas. Sometimes microscopic cells remain and begin to grow again. So I need another surgery." "A minor one, yes. Nothing like the previous procedure. We can remove it laparoscopically with minimal invasion. And this time, we'll use a cellular scanning technique to ensure we remove all lipoma cells." Yuri nodded, looking relieved. "When do we do it?" "I would recommend next week," Dr. Vormith suggested. "It will give your leg more time to heal before we subject you to another procedure." The following week, Dr. Vormith performed the minor surgery to remove the recurring lipoma. Using the ship's advanced cellular detection system, he was able to identify and remove every cell that showed the characteristic signature of the lipoma tissue. "This should prevent any future recurrence," Dr. Vormith explained after the procedure. "The technology allowed us to be much more thorough than would be possible with conventional methods." "That's a relief," Yuri said. "I'd rather not make tumor removal a regular activity." As Yuri's leg continued to heal, Dr. Vormith found himself increasingly fascinated by human medical conditions. He began corresponding regularly with Dr. Vasquez on Earth, sharing insights and comparing notes on various aspects of interspecies medicine. By the time Yuri was cleared to return to light duty at the mining colony, Dr. Vormith had written 2 research papers on human tissue adaptation and healing patterns, using the anonymous data from Yuri's case as a foundation. On Yuri's final day aboard the Helios, Dr. Vormith presented him with a small device. "This is a personal health monitor calibrated specifically to your physiology," the doctor explained. "It will alert you to any unusual tissue growth or bone density changes. Consider it a precautionary measure." "Thanks, Doc," Yuri said, attaching the device to his wrist. "I appreciate everything you've done, not just the surgeries, but taking the time to understand human medicine better." "It has been a mutually beneficial relationship," Dr. Vormith replied. "Your case has significantly advanced our understanding of human physiology and pushed me to become a better xenophysician." 6 months later, Dr. Vormith received a communication from Yuri. The human had completed his mining contract and returned to Earth, where he had accepted a position as a consultant for the Interspecies Medical Exchange Program. "Your experience inspired me to get involved in bridging the gap between human and alien medicine," Yuri explained in his message. "Plus, the health monitor you gave me has impressed every doctor I've shown it to. Earth medicine is looking to develop something similar." Dr. Vormith felt a sense of satisfaction as he recorded his response. "I am pleased to hear of your new endeavors, Yuri. Perhaps our paths will cross again in a professional capacity." The Interspecies Medical Exchange Program has long sought to recruit Xelorian physicians. A year after Yuri's departure from the Helios, Dr. Vormith was invited to Earth to speak at an interspecies medical conference. His research on human tissue adaptation had gained recognition throughout the medical community, and he had become something of an authority on human physiology among non-human physicians. At the conference, he was reunited with Yuri, who was now coordinating educational exchanges between Earth hospitals and alien medical facilities. "Dr. Vormith," Yuri greeted him warmly in the conference hall. "It's great to see you again." "The pleasure is mine, Yuri," the doctor replied, noting that the human looked healthy and fit. "How have you been? No more growths or broken bones, I hope?" "Clean bill of health," Yuri confirmed. "The monitor you gave me has been keeping track. And the leg is completely healed. I even ran a marathon last month." "Impressive," Dr. Vormith nodded. "Human resilience continues to fascinate me." "Actually, I wanted to ask you something," Yuri said, lowering his voice slightly. "The exchange program is looking for a Xelorian physician to head up a new department at Massachusetts General Hospital specializing in comparative physiology. Your name came up in the discussion." Dr. Vormith's skin rippled with surprise. "Me, on Earth? Why not?" You already know more about human medicine than most alien doctors, and your research is groundbreaking. Plus, you've proven you can overcome your initial reactions to human conditions. Dr. Vormith considered the proposition. His experience with Yuri had indeed changed his approach to medicine, opening his mind to the remarkable diversity of biological adaptations across species. "I would need to consider such a significant change carefully," he said finally, "but I am intrigued by the possibility." "That's all I ask," Yuri smiled. "Think about it, and in the meantime, I've arranged for you to visit some of our medical facilities while you're here." Over the next week, Dr. Vormith toured several Earth hospitals, observing human medical practices firsthand. He was impressed by the ingenuity humans displayed in developing treatments, despite their relatively limited technology compared to some other species. By the end of his visit, Dr. Vormith had made his decision. He met with Yuri and the exchange program directors to accept the position at Massachusetts General. "Your experience aboard the Helios demonstrated exactly the kind of adaptability we need in this program," the exchange director told him. "The ability to overcome initial fear or bias and approach alien physiology with scientific curiosity is rare." "I had an excellent teacher in that regard," Dr. Vormith replied, glancing at Yuri. "Sometimes the most important medical lessons come from our patients rather than our textbooks." 3 months later, Dr. Vormith had established his department at the Earth Hospital. His team included physicians from 5 different species, all specializing in interspecies medicine. Yuri served as the human liaison, helping to bridge communication gaps and cultural misunderstandings. During a quiet moment in the department lounge, Yuri found Dr. Vormith studying a holographic model of the original tumor that had brought them together. "Still fascinated by that thing?" Yuri asked, bringing the doctor a cup of specially prepared Xelorian tea. "It represents a turning point in my medical career," Dr. Vormith replied, accepting the beverage. "The moment I realized that my own physiological biases were limiting my effectiveness as a physician." "Well, your terror certainly made an impression on me," Yuri laughed. "I've never seen anyone so horrified by something benign." "In retrospect, it seems ridiculous," Dr. Vormith admitted, "but it led to important realizations about interspecies medicine. What appears catastrophic in one species may be merely inconvenient in another." "And now you're teaching that wisdom to others," Yuri noted. "The residents who rotate through your department are learning to see beyond their own biological frameworks." Dr. Vormith deactivated the hologram and sipped his tea. "I have come to believe that the future of medicine lies in this cross-species understanding. As humans continue to explore and colonize new worlds, and as other species visit Earth more frequently, the need for physicians who can treat diverse biologies will only grow." "And it all started with you nearly fainting at the sight of my tumor," Yuri grinned. "I did not nearly faint," Dr. Vormith protested, his skin flushing blue. "I was merely processing the information." "Right," Yuri winked. "Processing it while turning white as a sheet and dropping medical instruments." Their friendly banter was interrupted by an emergency alert. A transport ship carrying diplomats from 3 different worlds had experienced a cabin depressurization incident, and multiple species were being brought in with various injuries. Dr. Vormith immediately shifted into professional mode. "We will need to prepare isolation chambers calibrated for each species' atmospheric requirements. Yuri, please coordinate with the emergency response team on the incoming vitals." As they hurried to prepare for the incoming patients, Dr. Vormith reflected on how far he had come from that first encounter with Yuri's tumor. What had once been terror in the face of the unknown had transformed into confident expertise. The emergency doors slid open as the first patients arrived. Dr. Vormith stepped forward, all 4 hands ready, his mind clear of preconceptions or fear, ready to provide care based on understanding rather than assumption. The xenophysician who had once been terrified by a benign human growth was now at the forefront of interspecies medicine, helping to build bridges of understanding across the biological divides that separated the galaxy's diverse inhabitants. And it had all begun with a simple reminder from a human patient. Relax, it's benign.